At the 2011 ASCO annual meeting, Dr. Richard Shilsky spoke about the increasingly important role of primary care physicians in caring for cancer survivors.
Well, the good news is that there are many more cancer survivors in this country than ever before. The estimates right now are something on the order of 12 million cancer survivors, and the number is growing. The cancer survivors have unique medical problems that their primary care doctors need to know about. They have issues regarding cumulative or delayed side effects from their treatment. They have risks of recurrence of the cancer for which they were treated, and they have higher risks of developing secondary new cancers compared to the average population. So all of these are issues that fall in the domain of what primary care physicians should be concerned about. Well, I think the primary care doctors really are increasingly an essential part of managing patients with cancer and who are survivors of cancer. Interestingly, we now have cancer treatments that are creating side effects that are oftentimes best managed by primary care physicians because they have the greatest experience. So I'll give you the example of hypertension. Many of the anti-cancer drugs that we now use that are so-called angiogenesis inhibitors have as a side effect causing high blood pressure. Oncologists are not necessarily the most experienced doctors for managing high blood pressure, so by looping in the primary care physician, even while the patient's on active cancer treatment, they can really help in managing some of those side effects of the treatment. Moreover, of course, when the patient completes their treatment and ultimately comes back under the care of their primary care physician, there I think it's essential that the primary care physician really understand what was the cancer diagnosis, what was the treatment, what are the likely side effects of those treatments and how might that be manifest in patients in the years to come. And then most importantly, what does the primary care physician need to recommend to the patient in terms of follow-up of the cancer diagnosis and then screening for new cancers. Of course, we would strongly encourage that there be this good close collaboration between the primary care physician and the oncologist. Now, interestingly, oftentimes it's the patient who, of course, is the bridge between the two. And patients have different perspectives. There are some patients with cancer who are actually very reluctant to transfer the care to the primary care physician. They've developed a bond with their oncologist. They think that maintaining that bond is helping to keep them healthy and so on. There are other patients who frankly complete their cancer treatment and want to forget about it and don't want to even bring it up with their primary care physician. So part of the obligation I think that oncologists have is also to encourage patients to talk with their primary care doctors about their cancer diagnosis, which is now an important part of their medical history.